Good morning, everyone. I am Sumaya M. Lantud. For this lesson, we will be talking about beta blockers. So these are the objectives of this topic. First, to know the MOA of beta blocker. Second, to determine what is beta blocker. And lastly, classification and brief overview of beta blockers. Beta blockers were first developed by Sir James Black at the Imperial Chemical Industries in the United Kingdom in 1962. So they are considered one of the most important contribution to clinical medicine and pharmacology in 20th century. And Sir James Black was awarded the Nobel Prize in 1988 for advances in medicine. Before we go to MOA of beta blocker, let's define first. So what is beta blocker? Beta blockers, also known as beta adrenergic blocking agents, are medication that reduce blood pressure. Beta blocker as a class of drugs are primarily used to treat cardiovascular diseases and other conditions. Beta blockers are indicated and have FDA approval for the treatment of tachycardia, hypertension, myocardial infarction, congestive heart failure, cardiac arrhythmias, coronary artery disease, hyperthyroidism, essential tremor, aortic dissection, portal hypertension, glaucoma, migraine prophylaxis, and other conditions. They are also used to treat less common conditions such as long QT syndrome and hypertrophic obstructive cardiomyopathy. How does beta blocker work? Beta blockers primarily block beta 1 and beta 2 receptors and thereby the effect of norepinephrine and epinephrine. By blocking effect of norepinephrine and epinephrine, beta blockers reduce heart rate, reduce blood pressure by dilating blood vessels, and may constrict air passages by stimulating the muscles that surround the air passages to contract considered an adverse side effect. Beta blocker work by blocking the actions of hormones called adrenaline and noradrenaline. These hormones make the heart beat faster to make the heart beat faster and with more force. Blocking them makes your heart beat more slowly and with less force, which reduces your blood pressure and the strain of your heart. There are three types of beta receptors, and they control several different functions based on their location in the body. So first is beta 1 receptors are located in the heart, eye, and kidneys. Second, beta 2 receptors are found in the lungs, gastrointestinal tract, liver, uterus, blood vessels, and skeletal muscle. And lastly, beta 3 receptors are located in the fat cells. There are two classifications of beta blocker, the selective beta blocker and non-selective beta blockers. So these are the drugs that includes in selective beta blocker. So the mnemonics of this drug is Ambien. A is for atenolol, M metoprolol, B bisoprolol, B betaxolol, E ismolol, A acebutolol, A nebivolol. So the most commonly prescribed in antihypertensive is the atenolol because when you take atenolol, it will decrease cardiac output and it will lead to decrease your blood pressure. And also the nebivolol, it will increase the production of nitric oxide leading to vasodilation. So there are three drugs in non-selective beta blocker. First is labetalol, which is mixed alpha and beta receptor. Second, carvedilol blocks alpha 1 receptor and SVR. And lastly, the propanolol, both beta 1 and beta 2. Beta blocker is also a drug class that block norepinephrine and epinephrine from binding to beta receptors on nerves. Norepinephrine and epinephrine are produced by nerves throughout the body as well as by the adrenal glands. So, these serve as neurotransmitters that may be active locally where they are produced or elsewhere in the body. When they are released into blood, they are both alpha and beta receptor in the body. So that's all for today's lesson and thank you for listening.